Some of the biggest challenges are probably the embargo on staffing. So they've had to find different ways to deliver that same service with less staff. And what it hasn't allowed them to do is develop regulation around pharmacy technicians and assistants that will allow to fill that gap between pharmacists. So now we've got pharmacists who are highly trained, who are back in the dispensary checking technical work of technicians and not allowing them to do what they're trained for, which is clinical appropriateness of prescribing. So that's one of the huge challenges. Secondary to that is probably the need to specialise, and they don't necessarily have the resources. They're highly regulated, but they don't necessarily get to specialise like cardiac pharmacies or whatever. They're kind of spread as generalists, and they don't get to do what they're trained to do most of the time. In my opinion, there's significant scope to address some of the inefficiencies they have despite the embargo. In fact, it could be one of the driving forces that makes them more efficient. Traditionally, we've kept pharmacists in the roles they've always done, and we haven't necessarily trained the technicians up to the skills that they would be able to do, which we see in other countries like Canada. We see them highly regulated, and they play a bigger part in the efficiencies, allowing the pharmacists to be what they're supposed to be doing. So I think there's significant scope to look at some of the issues that pharmacists are doing that are better done by a better group of people, and allowing the pharmacists to become more effective in what they do. That'll save money on just the cost of the person doing that job, but also it'll reduce errors because the pharmacist is checking for clinical appropriateness, and then there's less rework and less errors going on. So there's a cost saving, and there's the ability to be efficient within that. I think there's huge efficiencies to be found in many processes done by pharmacists and pharmacist technicians. So they tend to do a lot of operational processes as opposed to transactional, and therefore there's necessarily scope in there to look at things like inventory control, so the cost of their medications that get wasted, the communication between other departments in the hospital. The thing about a pharmacy is they're very central in a clinical support role to the rest of the hospital, but unfortunately they can become isolated. So inefficiencies occur because they're siloed from the other disciplines that depend on them. So I think there's issues around transport, excessive drugs being thrown out or not being counted, a lot of inventory control, a lot of transport, a lot of miscommunication, telephone calls, that kind of thing that add to their workload and have them still not being efficient. So working across the entire organisation with the disciplines that depend on them, there'll be huge efficiencies across all angles there. A lean pharmacy operates like a well-oiled machine. Everybody knows what they're supposed to be doing. All parts of the organisation are communicating effectively with them. There's good control of inventory, there's good control of flow within the dispensary itself, and there's really good efficient communication between clinical pharmacists that are out in the organisation and the dispensary who are involved in delivering this service to patients. There's less frustration among staff, there's less phone calls, there's less paperwork. There might be physician order entry scans, so we decrease the errors of prescribing errors that cause huge angst and safety issues within a hospital. I think they're happier staff, they're more productive staff. We've got a pharmacist doing what they're trained to do, and we've got technicians who really know their job from the technical side. What's great about lean is it is absolutely a win-win situation. In fact, a win-win-win for all those three categories. A lean pharmacy from a patient point of view means we have less errors. We've got less chance of giving you the wrong medication at the wrong time, in the wrong dose or whatever. And therefore you get a quality service, you get it when you need it, and there's less chance of error. From a staff point of view, that already adds to their job satisfaction. They're doing a good job, do it at the right time, the right pace, and they're under less pressure. There's less frustration, less rework going on, so they deliver that quality service. So the patients and the staff delivering that service have already got the payoff. The knock-on from that is that being efficient in those areas, pharmacy is a linchpin clinical service for the rest of the organisation. So savings made in the pharmacy have a knock-on effect because nursing, medicine, all the inpatient care units, outpatient units become more efficient through communication, through less rework, less defects going on. And with the inventory control, we're actually throwing away less medication and wasting less medication, and therefore we get hard dollar savings on top of the kind of soft stuff where the staff are doing the right job. At the recent hospital pharmacy forum, it became obvious people wanted to know next steps. So what I'd suggest is get a diagnostic on your pharmacy to see what opportunities are there, get some training in basic process improvement, and then have a look at the material available on our website.